with the aim to analyze its external validity, which can be good for other regions in Spain. Also, you can see my name there, but I'm here on behalf of a group from the university, from the Catalan healthcare institution, whose personnel helped with that. Without the collaboration of many professionals working together, the program couldn't have been developed. So I mentioned the Catalonian example, not the Spanish example, because of this reason. Maybe you don't know that in Spain we have 17 regions, and all of each of it with own parliament. That means that we have nationwide regulations, but also region-wide regulations, and both affect into healthcare settings and other policies. Catalonia is there on the upper right corner. More specifically, we worked on a small-sized city called Lleida. You can see Barcelona is on the right side. Maybe you know Barcelona, maybe you don't know Lleida. It's a very beautiful city, by the way. Before we started our program, some other small approaches were done in cities in Catalonia, also in Spain. But all these projects, or most of these projects, are not well known because they are not published. Maybe they lack of proper evaluation. How we started with the Let's Walk, which means Caminem, Let's Walk program. Before we started the program I will show you later, there were a group of professionals, PhD medical doctors and sports doctors, with the idea of offering tools to general practitioners and nurses to promote physical activity. So their idea was to support exercise prescription or physical activity. I make the difference between these two from primary health care settings. We had, or they had, before I was involved, they meet all personnel from these primary healthcare settings explaining the purpose of urban routes in the city to use as a guide to prescribe. So please, can we leave there? That was easy. They marked popular routes that people, citizens, used to walk regularly. We can see on yellow, it's one of the 6 routes that starts, or it's supposed to start in the healthcare. And we assess the time that each participant would need to achieve this 3 to 5 kilometers route. And this is the map for the physician or the nurse. So he or she could have as a help, because we should individualize everything. But the age as a starting point, it means if a patient, a participant of the age of 35 has to walk that route, he or she should last between, the age of 35, between 33 minutes and 21 minutes to considerate moderate intensity because of the time. Also, that was this report form, prescription form, let's say, where the physician or the nurse might write the frequency and the duration of each walk, and the participant should report every time he or she walks to do a follow-up. Yes. Merci. The other tool we offered to the physicians was a small questionnaire that we cannot show here, we cannot show now here, with 3 questions to measure the occupational physical activity and leisure physical activity, to have a picture about that person, the habits of that person. It's not a validated questionnaire, it's not for research, it's for practical purposes. So we studied on that way. I would like to mention that in our country, general practitioners work in primary health care, community nurses, but not physical therapists. And that differs from other countries where national or regional physical activity prescription is being done. In Spain, only GPs and nurses work in primary health care, attending face-to-face consultations. So what happened? There were practical problems to install the software in the health professional computers, There were lack of prescriptions delivered to patients, so we couldn't follow up nothing because officially nothing was done. And we hadn't evaluation of the process. But by the time the teamwork published a paper about how they set the urban routes, they got a research grant, and we found spontaneous attitudes, positive attitudes from physicians and nurses to continue with the program. So what did next? I started working at that time, and we saw that physical activity promotion didn't work out by the time. So I would like to show you this image from Bouchard. So as you know, health condition is continuum, so it can be improved or can be getting worse. It's not always the same. Also fitness. We can have a better fitness tomorrow than today, thanks to the physical activity, by the way. It helps. And also we can have more resistance or more flexibility, but not altogether. Why not? It's not like this. So we advocate for this picture. We can improve fitness, which will improve health, by doing physical activity, so it's in Spanish. Physical activity is the center of that. But with exercising, controlled physical activity, repetitive plan, with the aim of maintain or improve fitness conditions, we can improve even better health. Of course, with sport, we can do that. But we all know that not all sport is helpful. That's why we focus on exercise instead of physical activity. So we had that background, and we wonder, did the professionals use the tools? Why not? Which professionals still know about them, and who was willing to collaborate? So we started a project which was aimed to evaluate the feasibility of the project. We already know that if people become active, they will be healthier. We know that. So let's try a new approach, a new project, and let's see if it works. These key issues, if we want to compare with other countries' program, we need to take into account, in Spain, also in Catalonia, physical therapists don't work in primary healthcare settings. They lack education of exercise. They are more focused on rehabilitation, not as other countries like in Finland, as far as I know. And in Spain, GPs and nurses may spend, as average, 6 minutes per patient. In other countries, I know in Finland it's over 25-30 minutes. So it's very different. We cannot ask the physician a lot of efforts in this short time. Also, legal and political framework, as I mentioned about before. What we did, we placed an exercise specialist into the primary healthcare settings 10 hours a week. We invited all professionals there to be part of the program without asking them to work more. We wanted to work on a real context. And we worked in 2 primary healthcare centers which were placed in 2 social, let's say, disadvantaged neighborhoods. It was just by chance. But those professionals really involved and really willing to collaborate worked there. So we moved there. We set protocols for referrals, follow-up, discharge, communication between professionals, and so on. The inclusion criteria of the program was to be above 18 years old, not to be senior. So why I am here? Well, most of the participants were above 50 years old. Maybe because another reason was to suffer from a chronic disease. The decision to include a participant into the program was taken by the health professional, but of course the participant had to agree on that. The exclusion criteria was that from the professional point of view, we considered that that participant couldn't benefit from the physical activity, or he or she had unstable condition. What was the inclusion criteria for the professionals to be involved in the program? Doctor, physician, or nurse working there, full-time or part-time job. Now the global crisis made this program very, very difficult as well, because many nurses and physicians were part-time. So they were involved into the daily routine, and after 3-4 months they quit. but still, many of them were involved. Thank you. We used that form. We worked on dose response of the exercise, like the French doctor said before. What's the proper dose? Exercise as medicine. So we control the frequency of exercise with the blue line, how many days per week he or she should exercise. We control the duration of the exercise. We said, sir, you should walk for 30 minutes. That route, which I know lasts 3 kilometers, 4 kilometers. And self-report evaluation of the intensity, visual scale. If the intensity was low, medium, or high after each walk. With this log filled in, we could follow up each participant and make a new prescription adapted to the circumstances. We follow up each person for a year if he or she didn't abandon before. These are some numbers. You will have this presentation, I think, so I would like just to stress. We had over 200 people referred, of which 180 were included. Some of them were lost. We are analyzing the reasons of that. They are not ready yet. Of those who came, 40 people just came to visit me once. 40 of them. Well, we can think that they weren't ready for the program, or they didn't know what was it going on. For those who continued with the program, many of them were still active. So 22 people were active all the program, 12 months, with a ratio that for 10 patients referred to the program, 1 became active. Became, let's say, was active, because some of them had an active lifestyle, some of them not. For those who, were active, no, they completed the program. For 3 referred, 1 was active. So we had a lot of dropout there, but I found a really encouraging article by a British researcher, and after a review, they found out in Great Britain, with all of programs they developed there, they needed over 19 patients to be referred in a physical activity prescription program to make 1 become active. Of course, we have a very small number of people, but I think it's a good feedback. What can be the future in our region, and by extension in our country, in Spain? The Lexwell program finishes its first phase. Now we will continue with other volunteer collaboration. It's not sustainable because it's volunteer, but we will try to work on that. The good thing is that professionals from both healthcare settings wanted to continue. Also, there is a Catalan-wide program set by the administration that also encouraged professionals to work on physical activity prescription, and sometimes professionals got different inputs and they didn't know really what to do. And also, next month, it will be launched a Spanish-wide program, Physical Activity Promotion, taking exercise on prescription from primary healthcare also into account. We wonder if it will have a great impact since we live in a big country. That's all. I hope you got a picture about our program, and I think you felt the difference we were working between physical activity and exercise. And the most important, we are working different professionals together, which is not easy at all. Thank you.